Hello, I'm Dr. Barnali Datta. I'm a pulmonologist, Director of Respiratory Medicine in Medanta. So I'm going to talk about stigma in TB today. A very important topic for all doctors and for everyone really, because all of us have either suffered from TB or we know someone who has, and it is important for us to understand, empathize, etc. Now, TB is highly stigmatized, despite being a disease that we have had for centuries. It's the oldest, one of the oldest diseases known to mankind. And yet, we haven't yet succeeded in conquering it, but also we have so much stigma attached to it that people don't even want to disclose that they have the disease because they fear the reaction from the other person. So there's so much misinformation, there is taboos and stigma around the disease, and a complete lack of awareness of what the disease is about and what happens in it. People are not aware that 2 weeks of treatment and you become non-infectious in pulmonary TB for the most part. So this is something that it is important as doctors, because we are the people who see the patients who have to dispel these notions. Now, stigma is of two types. One is self-stigma and one is social stigma. Self-stigma is what the patient develops. He develops feelings of very negative feelings about himself because he has got the disease and he feels he's somehow, he is to blame, he's somehow tainted, he cannot go out in the society and mingle with people. So that is self-stigma. And really that becomes a huge impediment to completing treatment for them because they are so worried about the stigma attached to it. It affects their mental health and everything else. Now, as a doctor, when we sit with the patient, all it takes is for us to assure them that this is an infection, and infections are always fully treatable and curable. So for them to know, for the patient to know that, look, I have TB, but TB is curable. I will recover in 6 months or 9 months, and I will be back to normal. And there is no reason why people around me cannot associate with me. Provided everybody continues to take infection precautions, I will be non-infectious very soon, but it is imperative that I take treatment. So to demystify it, to debunk the myths around it, and then just treat it like an illness that one has to get through. So this is very important for the doctor to handhold the patient and really take them through this course. Social stigma is, of course, what the patient faces from people around him, from the society at large, from friends, family members, work people, etc. Now, obviously, the doctor doesn't have the ability to change everyone's mindset, but at least the close people who live with them, they should be explained that, look, if you take the proper infectious precautions to prevent infection spreading, because the household members are the ones who are most likely to get the infection because of, close contact. They just need to wear masks. They need to be sensitive to the patient, empathetic to the patient, and continue to look after the patient. Ultimately, the patient will get better, and everything will be all right. Now, so this is one aspect to it. Women in Indian society, as with several other things, women bear the brunt of this kind of stigma. If a man has TB and a woman has TB, the woman always will struggle much more with society, family members accepting it. And that is, again, something we ought to be sensitive to because, we're all human beings at the end of the day, the man and the woman. And they all require the same amount of sensitivity, empathy, care, and understanding from people around them. Anybody could be in their shoes. And once we are able to, negotiate these paths of stigma, try to overcome the stigma that is in everybody's mind, then we are doing a good job of dealing with TB. Now, as doctors, before we can do anything, we have to free ourselves of the stigma. If we are insensitive to a patient with TB who enters the clinic room and we tell them, go out, you have TB, that is not acceptable. You wear a mask, you protect yourself, but your job is to look after the patient. So first, free yourself of the stigma, then explain to the patient not to feel bad about having the disease. He is not to blame. The disease does not define him. He will recover. He will get back on track. And then explain the family members who have accompanied the patient. And if you can influence this little sphere around you, I think you have done your bit in reducing stigma around the disease. Thank you.